What if I told you that one simple habit millions of men practice in silence could either protect your prostate or quietly damage it for years? A few months ago, a 72-year-old man sat in a urology clinic, eyes downcast, voice shaking. He said, "Doctor, no one ever explained this to me. If I had known sooner, my life after 60 would have been very different." Today, I'm sharing what that man, and countless older men, wish they had learned decades earlier. What worked for your body at 25 or 35 does not work the same way after 60, and this is one of the hardest truths many older men wish they had understood earlier. As men age, testosterone gradually declines, blood circulation slows, nerve sensitivity changes, and recovery time increases. These shifts mean the body no longer rebounds instantly from physical or hormonal strain. Masturbation itself is not harmful, but the frequency that once felt effortless in youth can become stressful if it doesn't adapt to these changes. Urologists often explain that both extremes, too frequent and too infrequent, can create problems for older men. Excessive frequency can irritate the prostate, especially when recovery time is ignored. The prostate naturally enlarges with age, and repeated stimulation without adequate rest can increase inflammation, pelvic tension, and urinary discomfort. Some men notice burning, pressure, or increased nighttime urination, but fail to connect it to overdoing, a habit their body once tolerated easily. On the other hand, long periods of complete suppression can also be problematic. Infrequent ejaculation may contribute to pelvic congestion, stiffness, and discomfort, particularly in men who already sit for long hours or have limited physical activity. The body thrives on gentle circulation, not extremes. What many older men wish they knew sooner is that moderation is not about rules or numbers, it's about awareness. The aging body gives clearer signals than the younger one. Fatigue after release, soreness, mental fog, or lingering discomfort are messages, not coincidences. When frequency aligns with the body's slower rhythm, many men experience better sleep, steadier energy, and improved urinary comfort. Listening replaces forcing, and patience replaces performance. Another overlooked factor is recovery. After 60, recovery is just as important as the act itself. Adequate hydration, relaxed breathing, and spacing sessions allow tissues to heal and hormones to stabilize. Men who adapt their frequency often report fewer prostate flare-ups and more consistent sexual function over time. The goal is no longer intensity, but balance. For example, a 68-year-old man noticed frequent pelvic pressure and nightly bathroom trips. He assumed it was just age. After a urologist suggested reducing frequency slightly and allowing more rest between sessions, the discomfort eased within weeks. He didn't stop. He adjusted. That small change helped him feel more comfortable, confident, and in control again. Understanding that frequency must evolve with age doesn't weaken masculinity. It preserves health, comfort, and dignity well into later years. Many men carry the same sexual habits they formed in their 20s straight into older age, without realizing that the body's tissues, nerves, and blood vessels change significantly over time. In youth, the pelvic muscles are strong, circulation is fast, and nerve recovery is quick, so rushed or forceful stimulation rarely causes noticeable problems. After 60, however, those same habits can quietly strain delicate structures. The prostate sits close to sensitive nerves and muscles that control urination and erections, and with age, these tissues become more vulnerable to tension and irritation. When masturbation is rushed, tense, or aggressive, it can increase pelvic floor tightness, compress nerves, and reduce healthy blood flow. Urologists often observe that older men with pelvic discomfort, weak erections, or lingering soreness are not suffering from normal aging alone, but from years of tension-based habits. Fast, forceful stimulation keeps the body in a stress response, raising cortisol and limiting circulation. This can interfere with oxygen delivery to penile tissue and irritate the prostate, especially if the muscles remain clenched before, during, and after release. Over time, this pattern may contribute to numbness, delayed recovery, or discomfort that makes men anxious about sexual function. A gentler, more relaxed approach works with the aging body instead of against it. Slower stimulation allows blood vessels to open fully, supporting healthier erections and nerve signaling. Relaxed breathing calms the nervous system, reduces pelvic tension, and lowers unnecessary pressure on the prostate. When muscles are not constantly clenched, circulation improves and tissues recover more easily. Many men are surprised to find that slowing down actually increases comfort and satisfaction, even if intensity feels different than it did decades earlier. This shift is not about losing desire or masculinity. It is about adapting technique to protect long-term function. Men who approach masturbation as a calm, body-aware activity rather than a rushed release often experience fewer urinary symptoms, less post-ejaculatory fatigue, and more consistent erectile response. The body benefits when stimulation is paired with relaxation rather than urgency. For example, a 70-year-old man reported dull pelvic aching and reduced sensation after years of fast, tense habits. After consciously slowing down, relaxing his breathing, and avoiding forceful stimulation, the discomfort faded within weeks. Sensation gradually improved, and erections became more reliable. The change wasn't dramatic effort, it was gentleness. Understanding that technique matters as much as frequency allows older men to preserve nerve health, protect the prostate, and maintain comfort and confidence well into later life. Many older men grow up believing that ejaculation is either something to fear or something that weakens the body with age. Modern urology paints a more nuanced and reassuring picture. The prostate is a gland that produces fluid as part of semen, and this fluid is meant to be released periodically. When ejaculation happens in a balanced, healthy way, it can help move this fluid out of the prostate, supporting circulation and reducing stagnation. Over long periods, stagnant prostatic fluid may contribute to irritation or a feeling of pressure, especially in men who already have age-related prostate enlargement. However, ejaculation does not work in isolation. Its effect on prostate health depends heavily on the condition of the body around it. Hydration plays a major role because prostatic fluid becomes thicker and more irritating when the body is chronically dehydrated. Stress is another key factor. Ongoing psychological stress raises cortisol levels, which can worsen inflammation throughout the body, including in the prostate. Diet also matters. Diets high in processed foods, sugar, and unhealthy fats promote systemic inflammation, which can turn even normal bodily functions into sources of discomfort. This is why many urologists emphasize that masturbation itself is not the enemy. Problems usually arise when ejaculation is combined with poor sleep, low water intake, prolonged sitting, and high stress. In those conditions, even normal sexual activity can feel draining or irritating. On the other hand, when ejaculation is supported by adequate hydration, gentle physical movement, and an anti-inflammatory lifestyle, it may contribute to prostate comfort rather than discomfort. Another important aspect is intention and relaxation. Ejaculation that occurs when the body is tense, rushed, or exhausted may feel very different from ejaculation that happens when the body is calm and well-rested. The nervous system influences prostate tone, and relaxed states support better drainage and recovery. Many older men notice that when they slow down, drink more water, and reduce daily stress, their prostate symptoms improve even without medication. For example, a 66-year-old man experienced frequent pelvic heaviness and mild burning sensations. He assumed ejaculation was worsening his prostate issues and began avoiding it. After consulting a urologist, he focused instead on hydration, daily walking, stress reduction, and balanced frequency. Within a month, the discomfort eased significantly, and ejaculation no longer triggered symptoms. Understanding that healthy ejaculation works best as part of an overall healthy lifestyle allows older men to care for their prostate without fear, guilt, or unnecessary restriction. As men age, the brain's chemistry changes just as much as the body does, and this is why habits that once felt harmless can become disruptive later in life. Dopamine, the chemical responsible for motivation, pleasure, and sexual arousal, naturally becomes less responsive with age. When the brain is repeatedly flooded with high-intensity stimulation, such as constant novelty, extreme imagery, and rapid visual switching from pornography, it begins to require stronger signals to feel the same level of arousal. In younger men, the brain often recovers quickly. In older men, that recovery slows, and the effects linger. Frequent porn use can quietly dull natural arousal. Over time, the brain starts associating sexual excitement only with screens rather than real sensation, imagination, or emotional connection. This can lead to weaker erections, delayed arousal, or anxiety about performance, even when physical health is otherwise stable. Many older men mistake this for inevitable AGI, not realizing the habit itself is reshaping their sexual response. Urologists increasingly hear men say, "I still have desire, but my body doesn't respond the way it used to." Often, the issue is not desire, it's overstimulation. Another overlooked effect is mental fatigue. Porn-driven dopamine spikes are followed by drops that can leave men feeling drained, unfocused, or unmotivated. In older age, this can worsen brain fog, reduce confidence, and even interfere with sleep quality. When masturbation becomes dependent on porn, the nervous system stays in a high-alert, novelty-seeking state, rather than a calm, restorative one. This stress response can interfere with healthy blood flow and hormone balance, both essential for sexual function. Many men are surprised by what happens when porn is reduced or removed. Without constant artificial stimulation, the brain slowly recalibrates. Natural touch, slower arousal, and even simple physical closeness begin to feel more satisfying again. Erections often become more reliable, not because of force or effort, but because the brain and body are communicating more clearly. Men frequently report improved mood, sharper focus, and a renewed sense of control over their sexuality. For example, a 69-year-old man struggled with inconsistent erections despite normal medical tests. He decided to stop using porn for a month while maintaining gentle, relaxed self-stimulation. Within weeks, he noticed stronger natural arousal, less anxiety, and better sleep. He realized his body hadn't failed him. His brain just needed time to reset. Understanding how porn affects the aging brain allows older men to protect their sexual health, confidence, and mental clarity without shame or fear. Many men are taught, often silently, that sexual changes with age mean decline, weakness, or personal failure. This belief causes real harm because it encourages men to ignore important signals their bodies are sending. Pain, unusual fatigue, reduced sensation, discomfort after release, or changes in erection quality are not moral judgments or proof that something is over. They are messages from the nervous system, hormones, muscles, and blood vessels. Urologists consistently emphasize that sexual response is deeply connected to overall health, especially as men age. As the body gets older, small imbalances become more noticeable. Reduced blood flow may show up first as weaker or inconsistent erections. Hormonal shifts may appear as low energy, delayed arousal, or prolonged recovery time. Prostate inflammation can reveal itself as burning, pressure, pelvic heaviness, or urinary changes after sexual activity. None of these signs appear randomly. They often surface during moments when circulation, nerves, and muscles are most involved, which is why masturbation or sexual activity becomes an early warning system. The problem arises when men interpret these changes emotionally instead of medically. Shame causes silence, and silence delays care. Many men push through discomfort, force performance, or withdraw completely, thinking they are protecting themselves. In reality, ignoring these signals can allow manageable issues to worsen. Early-stage prostate irritation, mild vascular problems, or hormone imbalance are often easiest to address when noticed early. Paying attention does not mean panic. It means curiosity and respect for the body. Another important point is that sexual fatigue or discomfort is not something to simply toughen up against. The aging nervous system needs more recovery and clearer communication. When symptoms are acknowledged, men can adjust habits, reduce inflammation, improve circulation, or seek medical guidance before problems become disruptive. This mindset transforms sexual health from something fragile into something informative. Urologists often say that men who stay observant age better sexually than those who deny change. They don't judge their bodies, they listen. That listening leads to better outcomes, less anxiety, and more confidence. Sexual response becomes a feedback loop rather than a test to pass or fail. For example, a 71-year-old man noticed lingering pelvic soreness and fatigue after release. Instead of dismissing it as just age, he mentioned it to his doctor. Tests revealed mild prostate inflammation and low hydration. Simple changes and early treatment resolved the issue. He later said catching it early saved him months of discomfort. Understanding that sexual changes are health signals, not failures, allows men to age with awareness, dignity, and control rather than fear. If you're over 60 or approaching it, understand this. Your body isn't betraying you. It's asking for smarter care. The men who age best aren't the ones